So hopefully you've had a chance to reflect on how ethnographic research could help you in this particular situation. But let's go through it just to think through a little bit more collectively. So ethnographic research here might show what actually happens in doctors' offices. So how do doctors actually talk to various types of clients? What kinds of treatments do they prescribe? If you are engaged in more macro level or policy, community organizing, or management types of social work in this situation, then maybe ethnography research of observing patients in their doctor's offices could help produce some information that could create policy change. Maybe it helps produce some information that can create trainings for doctors or other staff on how to respond to patients with cancer, especially different types of patients. So maybe in ethnography you see, or in this ethnographic research of observing, you notice that a particular type of patient, let's say African American patients who are diagnosed with cancer, end up getting different types of treatment prescribed, maybe more aggressive treatments prescribed. And there is research that suggests that sometimes that does happen. So ethnography would allow you to observe a little bit more about what's actually happening and potentially make some policy changes. It could also help you with coalition building and seeing different groups that might have different responses but could potentially become allies and coalitions and creating change. If you're a social worker that's working more at the micro level or an individual interpersonal level, maybe this ethnographic research could help you better understand points of intervention and how to actually help an individual client who is experiencing cancer, who has been diagnosed with cancer, and ensuring that she or he gets the best treatment possible. Now we're going to shift gears and talk about interviews, which is another really common tool that a lot of qualitative researchers use. So we're talking about the basic principles, advantages and constraints of using interviews, and we're going to give you some tips on how you can evaluate the quality of an article that you may look at that uses interviews. And then we're going to talk about how you can use interview-based research in your social work practice. So interviews are basically a form of data collection that can provide in-depth knowledge about individual experiences, cultural phenomenon, organizations, and events. There's several different types of ways that researchers use interviews, but here are some of the more common ones. So some interviews tend to be semi-structured. So that means that the interviewer is going to come to the interview with a set of questions, but they are also comfortable with deviating from those questions as information surfaces during the interview. So an example of a semi-structured interview might be what's called a life story interview. And this is a series of questions about one's life that asks them to think about their life as scenes from a book, or asks them about the characters or the people they interact with. How would they be characters in this book? What are the chapters of this book of their life? In contrast, an unstructured interview really primarily asks, it might ask like one question, one really open-ended question that then leads to a bevy of information that then leads to other questions. But an unstructured interview is going to be less likely to have a list of questions that kind of guide the interview. So an unstructured interview might start off with something like, where would you like to start the story of your life? In contrast to, how would you see the characters in your life? How would you see and asking a series of questions that sort of follow more in a chronological way. I have seen one interesting research that actually was unstructured, asked one question. It asked mothers about to describe their childbirth experience. And one question generated, I think, 45 minutes of a response from some women, just because there was so much information. It didn't require a lot of follow-up questions, although, obviously you can, but that one question was so rich and so packed with data. So anyway, there's some reasons of why one might use unstructured versus structured or semi-structured interview tactics. But the main point that you should take away from this is that there are these different structures of interviewing. And so when you read an article that talks about interviewing, you're going to see these terms pop up, and now you know what it means. So let's talk about some of the advantages of using interviews and why a researcher might use an interview to collect data. So it allows someone to describe a phenomenon in their own words. It also is a way to collect data in an in-depth way. It generates theory. So let's say, for example, in our cancer hypothetical that we went through, let's say I want to interview 15 African American patients and I want to interview 15 white patients about their experiences at a particular hospital. That is going to give me information about what those individuals perceive to be the processes at play, or how do they make sense of their interactions with doctors and other staff at a particular hospital. Whereas in contrast, in the ethnography module, we would more likely see, or the ethnography module, we saw that it's more likely to be used to see what actually happens and not just what people think happens. But interviews provide a lot of really good detail from one's own experience that we may not be able to see through mere observation. What do they think? What are they actually thinking in their head? It gives insight about processes in which health disparities may develop. Things might not necessarily be conscious, but it still provides this in-depth comparison of stories and experiences. Maybe we learn a little bit about their experiences with wait times, responses, treatments, emotions. These are kinds of things that we might learn through interviews. We could also interview the doctors or other staff. And again, we may not, the doctors or staff who are engaging in cancer treatment may be completely unaware that there's this disparity happening or that they're prescribing different treatments to different types of patients. But an interview, often you can still capture that. You can sometimes still see unconscious bias surface by some of the responses that people provide, even if they themselves aren't aware of it. It's very interesting. So anyway, so if you're reading an interview, an article that uses interview research, you'll want to take a look at how the researcher is describing not only the method in which they employed the interviews, but also how did they interpret the interview data and what was their process in doing that. So there are some constraints with research that uses interviews. So one constraint is that it's in the person's own words. So often the person cannot describe something that they're unaware of. Like I said, there's still ways that a researcher can still interpret things that maybe the person who's being interviewed may not actually be aware of, but you'd be surprised how much people say and describe things that can be really illuminating about a particular bias without them even knowing they have it. So another constraint, though, is that you can't really generalize the information you learn from an interview, usually from interview-based research, to the general population. Usually it's more constrained or confined in scope, and that means that if I interview 15 African-American patients at one hospital and then 15 white patients at that same hospital to compare, that gives me some interesting insight about that particular hospital. It gives me important theories to understand some of the processes that might be at play at other hospitals, but I can't say that the doctors here did this, and so I know that the doctors at this hospital will do that too. You just can't really do that with interview-based research. So if you see a research article that does that, red flag. So here are some other ways to evaluate the quality of research that uses interview-based interviews. So with interview-based research, the researcher is really looking at what's called data saturation, which means, are they getting enough interviews to really truly understand the process that they're studying or the phenomenon that they're studying? So maybe 10 really solidly good interviews will capture that. I would recommend 10 from each category so that you could compare. So it'd probably be closer to 20. But I have seen some really phenomenal research that, especially if it's looking at a very hard to reach population, have fewer interviews and be really successful at capturing a phenomenon. Generally, you would see a minimum of 20 interviews, but again, I've seen research that's really effective that uses far fewer than 20. Comparisons can be helpful, but interview-based research doesn't have to have comparisons. But you might want to think about, is there a reason why they didn't do comparisons? If it was just a matter of convenience, that suggests the research, maybe the article might not be the research you're looking for. You also want to look at, in the article you're examining, is what kind of themes emerge from the data? Are they rich themes that are supported by the interviews, or does it seem like the researcher is using too much interpretive license, meaning that the transcripts, and the transcripts are basically the written part. So a lot of times researchers who do interviews will interview someone, and then they'll have someone, or they themselves will then transcribe it. So they'll basically they'll write down everything that person said, and then they have a written document that actually shows what the interviewer or the person who was interviewed said. But you want to make sure that if someone is using a quote from the interview and then interpreting that it actually is a fair interpretation. Mostly this is not a problem, but sometimes you have some articles that show that the researcher has just taken a little bit too much license, and what they're suggesting isn't really supported by what the person said. So you'll want to take a look at the data that they're citing to make sure it actually supports the themes that are emerging. So next, what we're going to do, like we did with the ethnography section, is we're going to go through a hypothetical or a case study and think about how interview-based research might help you in this particular circumstance, so as a social worker. Now this is a hypothetical that we used previously, and what I'm going to do throughout this module is we're going to use the same hypothetical or case study, but we're going to see how it plays out differently with different methods. So I'm going to read the hypothetical again, and then I'm going to ask you to take a few minutes to reflect upon it before we regroup. You are a medical social worker that specializes in cancer treatment. You work with older adults. While your medical clinic serves patients across several counties, including both rural and urban areas, you have noticed that most of your patients come from one county. This county tends to be more rural. You want to understand what factors may be driving this disparity. So how could you use research based on in-depth interviews to help you? So take a moment to reflect upon this, and we'll regroup and come back and think about what are some ways that interviews could help you in this particular circumstance.